by the Medicine Center pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. It's hard to believe, but we're celebrating our 10th anniversary at the Health Matters radio program. We're planning some special shows to celebrate the milestone, so we hope you'll stay tuned. Let's begin today by thanking our sponsors, Studio Arts and Glass, Cleveland Clinic, Mercy Hospital, and of course, our socially distant technical producer, J.D. DeAngelis. And joining me is Brad White, a compounding pharmacist, and our special guest, Julie Dominik, occupational therapist at Cleveland Clinic, Mercy Hospital. Good morning and welcome back to the show.
Good morning, and I'm happy to be back.
During the month of April, Occupational Therapy Month recognizes all of the benefits of this specialized healthcare provides. But many of us do not know what an occupational therapist does or how their care benefits our lives. When injury strikes or long-term wear of joints and muscles requires rehabilitation, an occupational therapist, also known as OTs, provides the necessary exercises to get us back into our daily routines. Simply getting out of bed may be a challenge, or moving from one position to another becomes a problem we need to overcome. OTs have studied the movements required to make these transitions happen safely and to retrain our newly repaired body part to do the job. They know that these therapies can help improve weakened muscles and alternatives when others fail us. For every age and ability, occupational therapists provide care to improve the quality of life for each patient. This morning, we're going to talk with Julie about the services occupational therapists provide, especially as they relate to safe driving. We'd like to remind our listeners that our program is available on our podcast. So just grab your favorite podcast app on your phone or computer and look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime.
So, Julie, welcome back to the show. We'd like to thank you for your service as an occupational therapist, especially during this pandemic. Please tell our listeners about yourself and the responsibilities at Cleveland Clinic Mercy Hospital.
So I'm an OT. I've been working at Mercy for 30 years this past January, and I've been doing driver rehabilitation for about 23 of those years, in addition to other things that I've done here. Driving assessments that I do, just to give you a little bit of background about that, I do those, and they're related to medical conditions that people might have, and that's to determine if somebody has the potential to learn how to drive, can return to driving, needs adaptive equipment or techniques for driving, or needs to retire from driving. I've had the opportunity to work within our community as part of the Stark Safe Communities Coalition, as well as at the state level, while I'm currently involved with the Ohio Strategic Highway Safety Plan, the older road user portion, and I'm the at-risk driver subcommittee chair. I frequently provide lectures to various college programs as well as community education as those opportunities are available, including today. I've not been doing much of that, of course, since the pandemic, but I'm hopeful that we can get back out into the community soon so we can get that education out there.
So when we hear the term occupational therapist, the term seems to imply that a focus would be on helping a patient return to their occupation, and that's kind of what I was thinking too, or job. However, we know it means so much more. Can you explain the services occupational therapists can provide at Cleveland Clinic Mercy Hospital, and how important your services are to maintain the quality of your patients' lives?
Well, and I wanted to start with the general definition of what occupational therapy is, because I think it helps explain it. It's the use of assessment and intervention to develop, recover, or maintain the meaningful activities, which are also occupations, of individuals, which include typically work, self-care, and leisure interests. We here at Mercy actually have OTs that work in many areas. That includes acute care, inpatient rehabilitation, outpatient, including for hand therapy, neurologically impaired persons, pediatrics at our Tusk and Carrollton facilities. Also, we offer low vision outpatient therapy, as well as driver rehab, which is my niche. There's also OT in service lines at other places included in skilled nursing facilities, home health care, school systems, mental health areas. So, I mean, we at Mercy offer lots of options, but OTs can work in a variety of places. So it's actually helpful to get somebody back to being able to do the things that make them happy, as well as do the things that they need to do as far as taking care of themselves, in addition to being able to work outside of their home if that's appropriate. That could be volunteering, that could be taking care of their grandkids, it could be many different things. So we look at the broad base of trying to get people back into those functional things that are important to them and necessary.
So what injuries or diagnoses might indicate a person needs help or needs the help of an occupational therapist, and how do you evaluate those needs?
So I wanted to give you a little bit more of detail of the areas that we have at Mercy, but in the acute care setting that I mentioned earlier, those are mostly people that have been recently hospitalized for different reasons. Sometimes it's an illness issue. It might be a joint replacement. Maybe they had their hip or their knee replaced. It could be a major surgery recovery, like they've had open heart surgery. And the OTs are involved in making sure a person has the necessary abilities to return to their homes, or they're involved in discharge planning to determine next best options for them. So that may be that they're not ready to go home yet. Maybe they don't have the mobility or the skills or the strength, and they need to go to maybe an inpatient rehab setting or a skilled nursing setting, or possibly home with more home therapy at that point. When you're talking about inpatient rehabilitation, which Mercy has a unit at the hospital, that's more intensive therapy to address specific areas of self-care, mobility. We also look at cognition and visual perceptual skills to assist people typically in returning back to their homes. So that could be somebody that's maybe had a stroke, maybe they have a Parkinson's diagnosis, they're recovering from open heart surgery or multiple medical issues. So those folks need a little bit more time to get themselves better to move on. And that's we're looking at all of the different things again in that self-care, that work, that leisure issue. And those are things that OTs focus on to help people to get back. In the neuro setting as an outpatient, we're looking at even furthering those functional goals for those folks that are still having problems. And a lot of times that may include some home management skills, which we also do in inpatient rehab. So, and I guess I should explain that a little bit. So that can be as far as cooking a meal. You know, we all have to get ourselves something to eat, as an example. We also need to bathe ourselves. So we may be looking at functional transfers to be able to get somebody into a shower and then be able to do that function on their own, or even getting dressed. So we cover a lot of different areas. It's an amazing field because we can do so many different things. Our hand therapist here in the North Canton facility where I work at, she looks at more injury related things, some surgeries that usually are typically from the elbow down to the hands. And then she has targeted goals to look at improving range of motion, strength and coordination and function to help those people get back to being able to use their hands. So her job is extremely specialized. She has a lot of extra education to be able to do that. In a pediatric realm, we look at more kids with congenital disabilities, typically maybe cerebral palsy, spina bifida, they may be on the autism spectrum. So those are more long-term kind of situations where we're trying to help those kids to be able to function a little bit more independently. So those kids usually have therapy for a long-term situation. Low vision, which is an area that OT also does, that focuses on enabling the person with visual loss to safely and independently complete their everyday tasks with the loss of vision that they have. So that could be a glaucoma, a macular degeneration, a diabetic retinopathy. Those are all typically age-related issues that might affect somebody's ability to see well. And then I shared a little bit about my driver rehab hat that I wear, and we're going to talk a little bit more about that. So those are the areas of OT. So we have an amazing, wonderful job that we do because we can affect so many people's lives.
So I guess it's safe to say that an occupational therapist is really a person who helps us improve the muscles and movements required to complete our activities for daily living.
Yes.
Okay.
Absolutely. We are designed to help persons to be able to live more independently, which may require adaptation, compensation, learning new ways to do tasks, while the therapists are trained to use a wide array of techniques to assist with this. So we do many different things with the main goal of getting somebody to function more independently.
Julie, I know that a lot of occupational therapy begins at Cleveland Clinic, Mercy Hospital after a surgery or maybe even a sudden injury or sudden illness or injury. Does it continue on an outpatient basis also?
We absolutely can do that. A lot of folks need that continuum of care. So I mentioned earlier that acute care phase, and then we have inpatient rehab. We have the outpatient ability. There is also home health that's an option. So it depends on the level of challenges that that person has as to how far they need to have that therapy continue. So the people that have more challenges, maybe they've had a new onset diagnosis like a stroke, for example, that may have affected a lot of how they're moving, a lot of how they may be thinking or even seeing. They're going to probably definitely want to end up in an outpatient kind of situation because they're going to need longer therapy.
Okay, very good. So I know you focus on Mercy's driver rehabilitation program. Give our listeners some information about that and how that works.
So the driver rehab program is a comprehensive medically based assessment program to determine if a person is fit to drive while having the necessary skills for safe operation of a vehicle, including the visual, cognitive, and physical skills for the same. So here where I work up in North Canton, our Mercy facility here, I have a clinic that I do the clinical portion, as well as having a vehicle available to do an on-the-road portion if that's appropriate. I can assess a person's current, people that currently have licenses or previously had a license, in addition to those who might have a temporary learner's permit or even before that. I will do potential to drive assessments on a lot of the younger population that maybe we don't know if driving is going to be a good option for them or not. It's typically physician directed or an agency referral like workers' compensation or opportunities for Ohioans with disabilities. And I service persons from 15 and a half up to end of life. So it's a pretty comprehensive kind of situation with lots of documentation and recommendations that follow that process.
Okay. How about sharing some statistics about the number of older drivers in our state?
So people aged 65 and older represent the fastest growing segment of drivers nationally and in our state of Ohio. National projections suggest that 25% of the driving population will be 65 or older by the year 2025. That's a pretty big number. In Ohio, the number of licensed drivers age 65 and older increased 12% from 2014 to 2018, while as of last year, 2020, there were more than 2.1 million residents who were 65 or older, which is 18% of Ohio's population. So that's pretty significant, and it's just going to go up from there. These increases come with the heightened chances of older road users driving while they are impaired.
Okay, Julie, our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Hundreds of new items have arrived at the Half Off and Out By store in Louisville. How about over 700 watches to choose from? All readers and sunglasses are reduced to $1.69 each. Values to $20 and above. Memory foam pillows, canning supplies, lawn mowers, massage chairs, and lots of new toys. Lasco box fans, Utz chips, coffee K-cups, 4 for 99 cents, and many varieties. Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy, and see us on Facebook. Everyone has been tuned in to where to get their COVID vaccine. We've been proud to serve the community in this process. The Medicine Center offers many other vaccines like shingles, influenza, pneumonia, Tdap, meningitis, MMR, hepatitis A and B, and travel vaccines. Do you need a vaccine? Give us a call at the pharmacy or visit our website at medshoprx.com to schedule your appointment. Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing occupational therapy with Julie Dominik from Cleveland Clinic Mercy Hospital.
All right, Julie, you mentioned some of the statistics about the number of older drivers we're going to have in the state. How about we talk about some of the age-related changes that can affect driving?
So normal aging can cause gradual changes in physical and mental abilities, including vision, strength, flexibility, reflexes, in addition to minor cognitive changes. And that's just normal aging. That's all of us as we get older, that's going to happen. Sometimes we forget that, I think, because we don't realize that changes. The next thing that's kind of worth noting is medications, and you guys are the experts in that area, but medications can affect older road users. And just some things to remember, older Americans take more medicines than any other portion of the population, with the risk of medication side effects and interaction increasing with the more medications that they take. The average older adult takes 6 prescriptions or over-the-counter medications, which is significant. And I think we're going to talk a little bit later about medications, which I want some of your insight as well. So that's an area I don't necessarily know as much as I wish I did about. The other thing that we have to consider is as we get older, medical conditions then increase. So a lot of older adults have more chronic conditions than other portions of our population, of course. Because things wear out. So diabetes is a good example of that. People tend to get diabetes as they age if they're getting type 2 diabetes, and that can be a significant issue, especially if it's not well controlled or managed. Dementia, that's a word that most people are familiar with, and that is cognitive change, and that can look very different because there's different types of dementia, but that is something that certainly can start to occur for somebody past the age of 65 and can be pretty significant over time. So it is something that needs to be looked at. Somebody could have a stroke, and that usually, even though it's an individual incident, can certainly cause problems that are ongoing for somebody. So medical conditions is obviously something. And then the vision that I talked about earlier, that certainly is something that we have to consider, can change if you get a disease of some sort that's going to affect your driving.
What about vehicle size? Okay, now as we've shrunk the vehicle sizes down, we used to have these big old Lincolns running around there, or big Buicks and all those other cars. So now we've shrunk most vehicles, really significantly. Has that had anything to do with the safety or non-safety of drivers?
I mean, I just got a new vehicle myself, and the safety features that are on that vehicle just blow my mind, because there's so many things that they've now built into these vehicles, regardless of the size, with the airbags and the warning systems that are the lane departure warning systems, the braking warning systems, blind spot detection. There's all kinds of things that I think they've built now into the vehicles that actually are helpful to older drivers. The thing that I think people forget, and regardless of the size, because you still have some big vehicles out there, but typically the older drivers are not driving those large vehicles, those large Tahoes or Suburbans or whatever's out there. But I've found that a lot of older drivers will think that those safety features kind of are automatic, but they're not. You have to pay attention to them and understand how that vehicle works. So a lot of times I will find that I'm educating people about, do you understand how that works? It's not just because a beep's going off doesn't necessarily do anything for you. You have to pay attention to it so you know that you're out of your lane or something. So I think the size of the vehicles has changed for economic purposes somewhat. Obviously, gas usage and so forth. But it's interesting to talk to people about what kind of vehicles they choose, because a lot of older people are choosing the smaller SUVs because they sit a little bit higher because they're easier to get in and out of. And then they have some of those extra safety features. So, which I think is a good choice, because there's some really nice choices out there.
What about parking? Okay, now we've seen in downtown Canton, it used to all be parallel parking, and now we're seeing parking that, well, frankly, I think kind of obscures the highway a little bit. And as I back out in my truck, and I have a pretty big truck, I have difficulty in seeing what's around me. Okay. So you got to kind of back up and sneak out there, and real
Right.
slowly. And
well, and you must, I don't know if you have one of the backup cameras, Paul, but that is something that they instituted, I think in 2014 became a federal mandate, which is extremely helpful for those backing up situations. But again, as you just said, that doesn't necessarily mean you shouldn't still look. You've got to still be looking around. So when you have a larger vehicle like that and you're having to back out. Now, downtown Canton, you mentioned that, and they have those reverse angled parking spots, which I find very interesting. I know it's easy to get out of those, but I find it a little more challenging to find yourself getting into those the way that they want you to. So I'm not really sure of I'm not sure about that idea, but you see that in a lot of cities anymore. That's not, obviously we're not the first ones to do that.
What do you tell your people you're working with about the bicycle lanes? Okay, can they drive through the bicycle lanes? Can they drive over the bicycle lanes?
The bicycle lanes in downtown Canton are challenging too, because it doesn't make sense to people because of the way that they're designed. They're green painted downtown Canton. In other cities, they look different because sometimes it's a separate area. But you can drive over them to cross traffic, but you have to be mindful if there's a bicyclist in the lanes. But I mean, obviously, I think it depends on if you're driving down in downtown Canton. We don't have bicycle lanes everywhere we should in our communities, because you see bicycle riders sometimes on the roadways, which makes me very uncomfortable, because a lot of people don't realize we actually have a law that you're supposed to give them a 3-foot berth, which most people are not aware of, which means you've got to swing out wide and allow that bicyclist to have that space. But you have to be aware, if you've got traffic on your other side, that you got to adjust your speed. So that's a lot. That's a whole nother discussion.
I just think they've made this so complicated that it's almost impossible.
I don't disagree with you.
To whatever. So
I don't disagree with you.
Okay, I think it's time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
AM 10, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, state officials say Ohio's unemployment claims are starting to go down. Ohioans filed just over 23,000 initial jobless claims last week. That's almost half of what we saw reported last Thursday. About 1,200 of those claims have been flagged for potential fraud. The pandemic isn't quite over yet, but the restaurant industry is getting there. Restaurant sales went up 36% in March to $61 billion. That's just $1 billion shy of the sales from March of 2019, before the pandemic began. It's a strong sign for the economy heading into the spring and summer months as more Americans are becoming fully vaccinated. The defense has rested, and closing arguments will be heard on Monday in the trial of former Minneapolis police officer Derek Chauvin. Chauvin did not testify in the trial. The jury will get the case early next week. There's a move by some Democrats to expand the Supreme Court from 9 to 13 justices. However, House Speaker Nancy Pelosi does not support the bill expanding the court and says she has no plans to bring that measure to the House floor. More news coming up at 10 o'clock. I'm Pam Cook.
Hey, it's dollar bill.
Well, here it comes.
Here comes your shot in the arm.
I'm listening.
The shot in the arm keyword is
Chocolate. 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 Now go to WHBC.com to submit the word for your chance to win $1,000.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
You have to test for blood glucose. We know test strips can be very expensive at many pharmacies. At the Medicine Center Pharmacies, we supply you with a free Easy Max kit, monitor, and strips to either continue or begin with a new blood glucose monitor. And when you buy a package of 50 strips, they're only $7.99. And only at the Medicine Center Pharmacies you'll find this bargain in Canton, Louisville, Minerva, and New Philadelphia. See us on Facebook for more healthcare bargains.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Today into tomorrow, rather cloudy. High today 53, low tonight 39. High tomorrow 57. Sunday and Monday partly sunny with a passing shower. The high on Sunday at 59. Monday high 65. Clouds and a couple of showers around on Tuesday. The high on Tuesday at 66. Plan with confidence this spring. Download the newly redesigned AccuWeather app today. I'm Steve Williams for News Talk 1480 WHBC.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Today we're talking about occupational therapy and driver rehabilitation with Julie Dominik from Cleveland Clinic Mercy Hospital. We have a lot more to cover this morning, so let's get back to the show. I think we covered a little bit of this, but what are some of the really more important things that a person should make sure they do with regards to remaining fit to drive?
So the first and foremost thing is to see your physician regularly. And I think people don't realize, and I know the pandemic has put a little bit of a block on that because people were not going to see the doctor or attending to things that probably needed attention. So it's really important that they see their PCP as indicated. That may be every 3 months, 6 months, yearly, depending on what their conditions are. Obviously, if they have prescriptions that need refilled, they need to do that, whether it's a virtual or in-person meeting with their physician. So that's the first and foremost thing. If they have other medical conditions that need to be addressed on a regular basis, those specialists are also important for them to see. The second thing, and equally important, is to medicate as prescribed, as you guys well know, and to talk to their physicians or their pharmacists, which I find are very friendly, especially the two of you, regarding the reason for each of their medications, possible side effects, interactions, things they need to be mindful of. It is a person's responsibility to have the awareness of what their medications are for and why they're taking them and why it's important to take them as prescribed. It's also important that they're aware of the over-the-counter medications that they're taking, because sometimes those might be counter intuitive depending on what kind of conditions they have. For example, blood pressure may be one of those things. So they need to talk to their pharmacist. Pharmacists are always available. As you guys know, I've gotten wonderful information from the pharmacists I've interacted from, because they will make themselves available and answer questions as you have them. So, and sometimes the physicians are not as available. You have a little window of opportunity to talk to them while you're in their office, and maybe that's not enough time. So the pharmacist is a great resource. The next thing is a vision exam every 1 to 2 years or sooner if indicated. So it's really super important. I just had a woman that I saw that hasn't been to the eye doctor in 5 years, and she's 65 and she wears corrective lenses. That's too long, because unfortunately we have eye conditions that happen as we age that need to be addressed. We are not good judges of how our eyes are. People will say to me, but I see fine. Well, just because you can read something doesn't necessarily mean that your eyes are working as they should. So an eye doctor is really important to get in there to look at things. Now, there's optometrists and ophthalmologists, which do kind of different things. Optometrists usually are the ones that look for correction improvements they can diagnose, but typically they're not going to do any kind of operation. So an ophthalmologist will actually do surgeries like cataract surgery. So those are things that people need to be aware of, and they will be obviously sent that direction from an optometrist if necessary. Maintaining upper body and neck flexibility and staying physically active. I think what's happened to a lot of people in the last 12 months actually is they've become more sedentary, and I'm slightly guilty of that myself. But I think it's really important to understand how important it is that we move. And that's very necessary. They actually recommend you get about 150 minutes of exercise a week. And that sounds like a lot, but if you spread it out over 7 days, it's really, just a little bit of time each day. And it's super important for us to get that heart rate up and to get that body, keep that body moving. And the flexibility part is necessary too. If you think about, Paul, you mentioned earlier about backing up. So what do you have to do to back up your vehicle? You got to turn your head, and you got to be able to look over your shoulder so you can check those blind spots. As we get older, we lose that cervical range of motion. Our neck gets tighter. We kind of smush a little bit. We get a little bit shorter, and we can't move as easily. So it's real important that we keep that on our radar to keep that flexibility going. The other thing that I think is extremely important, and this has been a real challenge over the last year, is staying socially active. We need to engage with other people. We need to engage in activities. We need to do things that bring us pleasure. Those are things that I think are super important for our brain to maintain its abilities and to be challenged. And those are things that I think people don't put a high priority on, but we really need to continue to do that. So I'm hopeful that things are going to start to be a little more active, especially our older population. They lost a lot of the activities that they might have been involved in because we weren't able to do those things. For example, the volunteering at the hospital, our hospitals in this community. We did away with those during the pandemic. Those people weren't able to come in, and they're still not able to come in at this point. So that's a huge amount of older people that came to volunteer at the hospital, and that's what they did for their leisure, and it gave them a lot of activity and socialization. So very important to keep those things in mind as actually it's for all of us, not just older adults.
Let's talk a little bit more about medications. I think you're muted, Dad. You might have hit your button on your headphones there. So tell us a little bit more about medication. There you go. All right. So tell us about medications, Julie. Excuse me.
So medications can have adverse side effects, and I know a lot of people get the papers that come with each medication, and if you look at the side effect list, it's gigantic in most cases. A lot of people don't bother to take the time to look at that because it's a little overwhelming and it's kind of frightening for some folks. But the adverse side effects that we have to be concerned about is the drowsiness and the sleepiness, obviously with driving, the blurred vision, because that can happen, dizziness, slowed movements, fainting, which would be a significant one, inability to focus or pay attention. Sometimes some of those mood drugs will lessen that, so you're not quite as have heightened awareness. Some medications can make you more excitable, kind of jumpy. Some cause nausea. So those are all going to take your focus away from the attention really needed on that driving task. So it's real important that you are aware of that. And especially if you're starting to take a new medication, a lot of times you guys will put on the bottle itself, warning, do not drive or operate heavy machinery until you've taken this for a period of time, because you don't know how your body's going to react to it. So it's really good to talk to the pharmacist at that point. And please add anything that you guys have, because that's what you do.
Well, one of the key things is over-the-counter medications. If you throw in an antihistamine with some of these meds, it can really send you to sleep, actually.
Yes.
So all the over-the-counter things need to be considered when you're utilizing prescription drugs.
Yes. Very important.
So I think while I was muted, we missed one question. What could... as you said, that the early in the show, older drivers are growing at a rapid rate. Okay, or show better said, are on the road.
Right.
That sort of thing. So, and we were talking, I think, before we got on the air, that younger drivers too are really, speeding, driving too fast, in and out. I've had people jump in front of me and from the right lane to the left lane, and with almost no concern for signaling and that sort of thing. So
right.
what happens in a driver training situation for a new person, like a 16-year-old who just gets whatever? Do they caution them to pass on the left instead of on the right? Or more and more people are passing on the right.
Yeah.
And it's almost like you got to have four eyes. You got to have two that way and two forward.
Well, I can give you a little bit of insight with the driver training situation currently. So what you have to understand is that we now are doing all of the online education. It's all online. So there's no classroom interaction, which is unfortunate, because I think it gives the opportunity sometimes for that discussion, why this is important, or to show some of the things that can happen if you don't do things a certain way. So we have this 24 hours of education that's just on a computer, which unfortunately probably doesn't allow for a lot of interaction or a lot of really laid down information. And then we only have 8 hours behind the wheel with a licensed driving instructor. So that 8 hours is utilized to teach them skills and to review things per the curriculum that are very important to know. But we don't get a lot of time, and I don't do a lot of that direct work, but our driving instructors here in our community do, is we're giving them skill instruction versus practical information oftentimes, because 8 hours isn't a lot of time. So they're supposed to get a lot of in time with their parents to provide that extra instruction, like you just mentioned. You pass on, the passing lane is the left, the right lane is the travel lane, depending on what circumstances you're in. Those are things that I think we are missing. And the other thing you have to remember is at the age of 18, we don't need to have driver education. So all you have to do is go and pass your driving exam, which right now is being done in a format that is not even on the actual roads of our community or our state. So we are putting out drivers right now that I'm afraid are not very aware of the rules, the practices, the courtesies, those kind of things. But that's just my awareness and my observation. So it's a dangerous world out there, and you really need to stay on your toes. And that's why it's so important that you stay attentive.
there's a couple of areas in on Route 30 that are particularly challenging, and that's where Cherry comes in, on the right-hand side, and then you get up to the lanes that you have to switch over to if you're going southbound or northbound on the interstate, 77, and then I go over that probably once or twice a day, and every time I get to that section. And you got to really have your eyes about yourself.
Yes, you
And you have to really be paying attention. I'm sure you've been there,
Yeah.
in that section of the road because it's heavily traveled. So,
And right now with all the construction in that area, oh my goodness,
correct.
it's extremely dangerous.
Correct.
So you really, if you're coming 77 north and trying to do the split there and just trying to figure out what you're doing, it's very dangerous. So you have to stay very, very alert. And hopefully that'll all improve somewhat when that construction's all done, but it's still going to be a while till that happens. But certainly, driving is a full attention task. And that's why we can't do other things when we do it. And I think people don't realize that. They think the cars are so smart now that they don't have to be as smart, but that's not really the way. That's not the intention.
I see one car out there now that parks itself parallel, and I'm thinking, that's interesting.
It is. I'm not sure I trust it, but I guess
Yeah.
I guess we're not there yet. So we'll see.
Okay. Our final break is here. You listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Do you have to blood test because you have diabetes? Is the price of the test strips nearly have you in the poorhouse? At the Medicine Center Pharmacies, we give you, at no charge, a complete test kit with strips as a starter. Then when you purchase more strips, expect a cost savings price of $7.99 for 50. A huge savings over many brand name test strips. So stop in any Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia for info. Also, we have curbside service, drive-through windows, and free delivery service. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Hundreds of new items have arrived at the Half Off and Out Buy store in Louisville. How about over 700 watches to choose from? All readers and sunglasses are reduced to $1.69 each. Values to $20 and above. Memory foam pillows, canning supplies, lawn mowers, massage chairs, and lots of new toys. Lasco box fans, Utz chips, coffee K-cups, 4 for 99 cents, and many varieties. The Half Off and Out Buy store in Louisville, next to the Medicine Center Pharmacy, and see us on Facebook.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. This is the last segment of our show.
All right, Julie, can you tell us some of the warning signs which might indicate that a driver is having problems related to being able to drive safely?
Yes. So the first one is forgetting how to locate a familiar place getting lost, getting misplaced. That's something that obviously would be a big warning sign, especially if you've lived in the same area a long time and you're familiar with the area. Failure to observe traffic signals and signs. So, you used to always be able to do that, or that person did, and all of a sudden they're running through stop signs, or they're not stopping at red lights. That's obviously something is not right if that's happening. I know we see that happen all the time, but this is more of a change in behavior. So getting angry or confused when driving, which would be out of character for them typically, that would be a sign that we would be concerned about. Hitting curbs, confusing the gas and brake pedal, that's a pretty significant one. Stopping in traffic for no apparent reason, which I've actually been in the car when people have done that before, and they can't explain why. Having an at-fault fender bender, crash, moving violation, which again is uncharacteristic, something that they can't explain why that happens. So, those are all things that if that happens to your loved one or your spouse or your parent, you should start saying, something's going on here. We better take a look at this.
So where do you start? I mean, do they call you? Do they talk to the doctor? What's the protocol?
I would say, so I do get phone calls like that, but the best option is to call the physician. So call that person's physician and try to have a conversation, or at least verbalize your concern about that situation, because they can then order a OT, functional community mobility assessment, which is what my driving skills assessment is called. And then we can check it out and document and make recommendations based on their performance. So that's the best thing to do if you're concerned.
So what's that look like? Do you go for a drive?
Well, we do. Initially, I have that clinic area that I mentioned earlier. I'm going to interview them, find out about their history, find about their level of function, their driving history, vision history, those kind of things I need to know up front. I've got some equipment in this room that I use, including something to screen vision, as well as a driving simulator to look at reaction time. And then I have a bunch of different paper pencil tasks, most of which are standardized to look at cognition and visual perception. So I can get a pretty good read as to how well a person is functioning. And then I can determine whether going out in the vehicle is appropriate. So if all is going pretty well, then I will put them in the vehicle and we will do a drive out here in North Canton typically. And I have the access to the interstate as well. So I will use that if that's appropriate.
Okay. What are some of the projects that you're being focused on for older drivers in the next few years?
So I'm involved with the strategic highway safety plan for the state of Ohio. I mentioned that earlier. And I have to tell you, we have a really exciting thing going on right now in Stark County. We have a piloted program, which hopefully will roll out to the entire state within the next couple of years. It's called the DOSI, and I'm just going to highlight it briefly. It's actually a driver orientation screen for cognitive impairment. And it's meant to be a roadside tool for our law enforcement officers. And actually, they can use it to kind of determine if somebody's having a cognitive impairment situation. And then it actually gives them recommendations for them to notify the BMV so that a physician follow-up can take place. So it's a really exciting thing that I've been involved in the last several years, and we actually are rolling it out. We're still doing the education process right now, but we've got about 11 of our local law enforcement agencies on board with the education, and they actually have started to use it out in the field. And we've gotten some really great feedback. So it gives them that opportunity because they don't have that training. They don't necessarily know what to look for. So it's really exciting that I'm part of that.
So is this the upcoming virtual program you're talking about?
No. The virtual program that I'm going to be speaking on Wednesday, April 28th at noon. I'm going to be talking more about staying fit to drive, kind of with a mature driver focus of it. So I'm going to highlight and expand some of the things we discussed today so that I can give some tips out to the people that are attending that. So if people are interested in checking that out, they can go to the CantonMercy.org website or our Facebook page at Canton Mercy and go to the events tab and register online at that point. If anybody's got specific questions for me at any point in time that they may have concerns, I'm located at our North Canton facility. And my phone number is 330-966-8920. So feel free to give me a holler as well.
One more time.
330-966-8920.
Okay, that's good. What about, did you say earlier in the program, or did I kind of miss this, that There's no real driver training right now. It's all virtual or testing
Well,
or.
there's there's virtual education, classroom education. Hopefully they'll be back in the classrooms at some point soon. But there's 8 hours required if you're under the age of 18 in the vehicle with a licensed driving instructor. That's a requirement, and you're supposed to have 50 hours with a parent or a licensed driver over the age of 21 prior to testing. If you're 18, you don't have to have any of those requirements. You can just take your test. The test currently is not being completed by an examiner within the vehicle on our roadways. It's a parking lot examination only. So it is a very unfortunate situation.
Yeah, for sure. So we have nobody checking out whether they're able to drive a vehicle on the highway or not.
That is correct. And normally the highway is not part of our license exam process anyways, but we are on the roadways and changing lanes and following traffic signals and interacting with other vehicles. Currently, that is not the case.
I recall when I took my driving test years ago that we went out on the highway. It wasn't a very long run, but
Right.
we did go out on the highway. So
well, I think it's a liability and danger issue for our examiners, because unfortunately sometimes they are in vehicles with people that don't know very well about how to drive. So I get it, and it's also logistics, trying to get people access to the highway, but. You do need to demonstrate some road skills, and right now we're basically demonstrating vehicle control only. So it's a little concerning, to say the least.
So where are the testing sites?
Well, each county has a BMV, and they're not in every county. We don't have 88 testing sites, and right now we have less than that because of the situation. So we have a testing site here in North Canton at the exam station up on Whitewood off of Main Street. Okay. So we do have one close.
Guess what? We're out of time.
All right.
Thanks very much, Julie Dominik, occupational therapist at Cleveland Clinic Mercy Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare professional. And thanks to Studio Arts and Glass and Cleveland Clinic Mercy Medical Center, who are sponsors. As always, thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy, right here on News Talk 1480 WHBC. Thanks, Julie.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists, Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy.